All right, thank you for joining me this morning. I called this briefing to reassure the citizens of Reading that their city is taking every step to keep our residents safe and healthy, and that we are doing everything we can to minimize the spread of COVID-19. I've asked our police chief, Bill Schueller, and our fire chief, Cullen Kreider, to be here. In a minute, they will talk about the changes we've made in public safety to keep our citizens safe, while also keeping our police officers and firefighters safe. The COVID-19 pandemic has affected each of us in the community in one way or another. And I want to take a few minutes to let you know that we are working hard to keep our city moving forward. First, I want to say a special thank you to all of our frontline workers and essential employees who are working diligently to continue to provide services for each of us every single day. To our healthcare workers who are tirelessly providing care to those who are ill, not just from COVID and related illnesses, but also taking care of all of those who have a myriad of needs. Thank you for being resilient and dedicated to caring for our community. To all of the grocery store workers, cleaning staff, mail carriers, delivery employees, truck drivers, and all of those workers who are keeping our essential services open and running for our needs, on behalf of our community, thank you for your long hours and dedication to all of us. We honor your work and truly appreciate what you're doing for each of us every day. To our teachers, educators, school staff, food preparers, and food delivery workers, thank you for your quick thinking and willingness to switch gears for the children of our community, particularly those of you who never thought you'd be creating an online learning lesson for our elementary school kids. Your efforts are noticed and appreciated. There are a lot of kids who miss their friends and teachers. I know it's hard not seeing friends and being uprooted out of the classroom so suddenly. And hundreds of teenagers are disappointed about missing out on end-of-the-year activities. We see you and are disappointed with you. These are difficult times, and none of us are coming out of this unscathed. I want to thank our community partners who are working with us to keep residents informed and safe. Shasta County's Dr. Ramstrom, thank you for your intelligence and wisdom and working incredibly hard to keep us up to date with all of the latest information about COVID and the guidance on how to best protect ourselves and our loved ones. And finally, to each of you in the community, please know that we are working hard at the city to continue to provide critical services and create ways to lessen the impact the shutdown has had on many of our businesses and on many of you. Here are some steps we've already taken. The city has suspended return to owner fees at Haven Humane. Animal regulation is temporarily waiving fees charged if your pet has been impounded. We've suspended late fees and interest on City of Reading payments. We know that finances are strained for folks, and we want to ensure families are given some time to make payments without penalties. We've suspended City of Reading utility shutoffs. We don't want anyone to be sheltered at home in fear of having their utilities shut off at this time. Focus instead on staying home and staying safe. We've suspended City of Reading utility late fees. The normal late fees charged for paying utility bills after their due date are temporarily suspended to ease the burden. We've also authorized the distribution of $50 to every RU account holder. Originally approved in December, the distribution was officially authorized at the end of March to credit all residential and business utility accounts with $50. This will be automatically credited to all customers' accounts. Even now, city staff are developing additional programs to present to the council that could provide additional relief for residents and businesses and help stimulate the economy as we head into uncharted territory. We've heard it often, these are unprecedented times. And I've heard folks say that it just feels weird, and it does. We're all in a time of uncertainty, but it is temporary, and we will continue to push forward together. Please know that your local leaders are continuing to work for you every day. We are connecting with state and federal resources to ensure our community remains safe and that the momentum we had prior to this pandemic continues to thrive. We need each of you to continue to do your part as well. Stay home. California and Shasta County are flattening the curve, but we are not out of the woods yet. Please go out for essential functions only. Wear protective masks if needed. Wash your hands frequently and thoroughly, and stay away from others if you feel sick. Help protect others, stay home, and please continue to follow the public health guidelines and directives. Thank you. And I'll have Chief Schueller come up now.
Good morning. I'm going to talk briefly about the changes of the Reading Police Department, what we've done to keep our essential services running since the Governor Newsom's stay-home executive order went into effect on March 19th. We've done it in stages. So stage one was when the order came out. We sent all our, what I consider non-essential staff, but are still essential to running the police department, those folks home to work from home. And that's our watch commanders, our department managers, detectives, and administrative staff. They all started working from home to keep them safe and keep us safe. We closed our lobby, except by appointment, so you can still pick up your car if it's impounded. You can still get property if you need to get it, or do the sex registration that you need to do, but it has to be done by appointment. But we are still here 24 hours a day, and if you need to get a hold of us, you can by pushing the red button outside of our lobby. Stage two is when we started seeing local cases here in Reading, and at that point we made some changes, some more radical changes, and that's where we took all of our detectives, our neighborhood police unit, and our traffic unit, and moved them back into our patrol division. Patrol is our number one priority, answering those 911 calls, so we wanted to make sure we had enough staff for that to happen. So by moving all of those back, we assigned our officers to 12-hour shifts in 2-week cycles. So for now, half of our department works for 14 days in a row, and the other half is home for 14 days, which matches the incubation period for COVID-19. So we know that for 14 days, we have half of our staff at home not being exposed out on the street, and so they're available in case our department does get infected. Our officers are also assigned take-home patrol cars, so you probably see a lot more cars at home. And that officer gets that car for their entire 14-day cycle, so they make sure it's clean, and then they sanitize it before it goes to the next person in the next 14-day cycle. So right now we're about a week and a half into the first cycle, and it's going well. We've got a lot of officers home with their families being safe. We've suspended all training and meetings unless they can be virtualized through WebEx or some other Zoom or some other format. And we've issued all our staff N95 masks, biohazard suits, gloves, and hand sanitizer. And you'll see anyone we're transporting to jail wearing a mask as well. They'll have a paper surgical type mask, although those are in short supply. Which all PPE, personal protective equipment, is in short supply right now. We've had a couple of community and business donations that have been extremely helpful for my department, but we continue to try and buy whatever we can. Like anybody else, it's difficult at this time. And then I'll talk briefly about crime. I talked about this a little bit last week with both of you, actually. I'd had other stats run through yesterday, and so we are down, we have 4,699 calls between March 20th and April 12th. So the day the order went into effect or the day after till yesterday, we had 4,699 calls. Normally we're running around 5,500 to 6,300. So we're down over 15% for last year and 25% for the previous 2 years. One would think that burglaries would grow as businesses are empty, but actually that is actually on decline too. We only had 58 reported burglaries during that same time period. Last year was 82. So we are down significantly, 29% between this year and last year in burglaries. That's a good thing. People are staying home and not out committing crime, so I'm happy about that. And then domestic violence cases, last week it looked like they were trending up, but after we've had another week of data, They're actually down about 21% from previous years, so that's another good thing, and I'm very happy to report that because it's a typical concern when people are home for long periods of time. Domestic violence rises. So good things. Our department's safe. We have no infected officers or staff. We're still out there doing the most important function and answering your 911 calls, and crime is down. So overall, good thing. All right, thanks.
Good morning. On February 28th, when the first case in California appeared, our department started working on an action plan with our EMS cadre and our Firefighters Association. We took inventory of all of our PPE, masks, goggles, gloves, and gowns, and realized we needed to make some immediate purchases to boost our supplies. We put a plan in place for the isolation or quarantine of our own employees, and are working with SHASCOM on identifying those patients that have those cold and flu-like symptoms. New disinfection procedures were put in place for our apparatus, our equipment, and our fire stations. And when the governor issued the executive order proclaiming a state of emergency, we really started limiting our exposure to patients and the public. All of our citizen ride-alongs, station tours, school visits, and public relations events were canceled or suspended. And instead of both fire and EMS crews entering a residential or commercial facility to treat a patient, we're sending one person in with the proper PPE to investigate and see what the needs of the patient are. And then SHASCOM's also asking patients to actually go outside and meet the first responders so we don't have to enter a structure. We created a new documentation process for our employees that respond to suspected COVID-19 patients. And we've since purchased 3 mobile ultraviolet systems to help us disinfect medical equipment, as well as the inside of a fire engine and our fire station living quarters. Our fire prevention staff is doing critical inspections in the field only and trying to limit their exposure as well. Although all of our multi-company drills have been suspended, we continue to do individual company training and more online training sessions. Starting this week, we'll be taking the temperatures of our employees when they arrive at the start and at the end of each shift. For those that present any symptoms, we'll work with Shasta County Public Health to try to get them tested. We are currently down about 28% in our total call volume. That's fires and EMS calls, traffic accidents, etc. But we're seeing a little bit of an increase in the cold and flu-like symptom calls that we're responding to. And about 23% of our EMS calls are actually requiring more enhanced PPE. So our firefighters are prepared and protected and trained to serve our community, and we ask that you follow the guidelines and we'll get through this together. Thank you.